Hi, I'm Les Bennett. I'm here representing the American Association of Pharmaceutical Scientists, who a number of years ago thought that it would be very worthwhile to have an opportunity to put on video and tape interviews with some of the most distinguished pharmaceutical scientists representing our field over the years. I'm very pleased today to have Professor, former Dean Jim Doluisio as our guest. Jim has a very distinguished career. He has a technique called the Doluisio method in terms of looking at intestinal absorption. He was an outstanding scientist. He was the third president of the American Association of Pharmaceutical Scientists, and has had a great influence on our profession as a science, but also the profession of pharmacy. And Jim, it is a real pleasure to have you here today.
Thank you, Les. It's a pleasure to be here with you especially.
Thank you. So Jim, I think it would be worthwhile to our audience to know what was the driving force of you moving in and becoming a pharmaceutical scientist.
Well, I actually started out wanting to be a pharmacist in my hometown of Bethlehem, Pennsylvania. And somewhere along that undergraduate training, I got interested in the drug discovery process and did PhD studies, and that led to a whole wonderful set of opportunities that I am very thankful for. But yeah, I just wanted to go back to Bethlehem, Pennsylvania and be a community pharmacist.
So you had an opportunity to work, I think, at SmithKline or SmithKline French in those days, yeah, with Joanne Toski as a young scientist, I think. And that Joe is also a legend in our field, and it'd be nice to reflect on some of that.
Well, you know, it's interesting how things happen. When I got my master's degree at Temple before I went to Purdue for my PhD, Joe actually came in and gave a series of lectures, the first time I ever heard about pharmacokinetics, in Harry Kostenbotter's graduate course. And so I knew Joe, and when I took a position as assistant professor at the Philadelphia College of Pharmacy, they had 9-month appointments, so in the summers I worked at SmithKline in Joe's group. And it went so well that SmithKline hired me as a consultant, and Harry Kostenbotter, Joe and I, just a great relationship. And when Joe moved from SmithKline to the University of Kentucky as dean, he invited both Harry and myself to join him, and happy to do so. It was, I enjoyed being at the Philadelphia College of Pharmacy in the center of that wonderful pharmaceutical industry in that eastern corridor. And but moving to Kentucky with Joe and being medical center based and doing the things we did in Kentucky was a great move. I owe a lot to Joe. Joe was a great mentor, great family man. He had a very close relation with Takeru Higuchi, and Tak was extremely helpful to me as well. So yes, I owe Joe.
So I think probably you and I are old enough to know, but maybe many of our viewers are not, that actually Joe was responsible for sort of the first controlled release dosage forms in terms of the different particles. And were you involved in that, Jim?
No, I came in just after that, but SmithKline had that spatial technique, and they had a drug called sulfaethadol, and if you ever wanted to work on a one-compartment drug, you wanted to work on sulfaethadol. I mean, you took 5 samples and they were all on that straight line. And so he had a nice drug and to work out his concepts. And Joe truly, I think he did well in the industry, and he was very innovative, but I think he was always an academician. He enjoyed teaching and did so. And when I was at the Philadelphia College of Pharmacy, he lectured in my courses as well. Great guy, but yes, in the laboratory he was extremely inventive, especially in the area of drug absorption. And you talked about, it might have been called the Swintoski technique instead of the Doluisio technique, because we sat around talking about the Brody-Shanker work on drug absorption that was just preceded that work, and it was kind of a group decision that said we ought to try getting the kind of results physical pharmacists are used to getting in biological systems where they aren't used to getting the kind of results we were used to getting. And we were able to modify that drug absorption technique in ways to get pretty good data out of a biological system.
That's good. Before we move to Kentucky, I'd like to stick a little bit with Philadelphia College of Pharmacy, because our 29th president of AAPS, Alice Till, was a student of yours at Philadelphia College of Pharmacy for her undergraduate training. And then she came after working at Merck and was a graduate student of mine.
Yes.
So we had some joint action in our future leadership.
You know, it's nice. And again, I started getting interested in being a pharmaceutical scientist as an undergraduate, and I'm glad we could interest Alice too, because there are some students that come along that just have such great potential, and I'm very proud of Alice, and I'm proud that she's following in our footsteps in the presidency of AAPS.
Right. That's great. So let's go to the University of Kentucky in terms of, tell us about, you know, it was really an environment that was electric. And I think in terms of the faculty that Joanne Toski brought together, and you were there and you went through the ranks, and yet you chose to go into administration. And you want to give us a little sort of history of what was going on there?
Joe was interesting. I was involved in developing the PharmD program at the Philadelphia College of Pharmacy. And when I talked to Joe and what his priorities in education were as he went to Kentucky, he talked about, they didn't have a graduate program at the time, he talked about developing a graduate program, but he talked with great enthusiasm about clinical pharmacy, and I kind of caught me by surprise. And when we went to Kentucky, it was, I think we had become the innovative school. We were at a university that had a young medical center, extremely important. No big hierarchies, no big boundaries to innovation. And it was a hospital that had a spectacular hospital service. A fellow by the name of Paul Parker directed it, and Paul just had a spectacular floor services, clinical services, and integrated completely into the educational program. So we did things that other people thought of doing. In fact, when I hear these big pushes in the late 80s that we should try doing this, that, or the other thing, I think back and thought, you know, we passed that bridge in '69. So, and because of that, we had just many visitors. Many people would come to Kentucky, and I remember your visit, but you didn't come to learn from us. We came to learn. We invited you to learn from you. Yes, it was a very creative period, both in terms of academic curriculum, in terms of clinical pharmacy services, and in implementation of a graduate program. Because we didn't have a graduate program when Harry and Lou Dittert and I and George DeGenis went there, Joe stepped up with an industrial concept. He says, you know, I'll fund technicians for you. Well, little did I know that one technician is, full-time technician is worth like 5 graduate students. They're totally committed to whatever you tell them to do, and they say, okay, I finished that, what's next? And you think, oh my God, are you back? And so his bringing that industrial concept of actually hiring technicians, and I was lucky, I had a technician by the name of Hetty Ton, who, that rat gut technique, she was a master at it. In fact, when Bill Higuchi wanted to duplicate it at Michigan and integrate some of his research interests, he actually invited my technician to Michigan to train his people on the technique. So let me tell you something, I have never run the technique.
Yeah, you've told me that before. I wasn't going to bring it up, but I'll let you say. So the Doluisio technique was never carried out by Doluisio.
I'm too squeamish.
So give us your movement into administration. What drove you in that direction?
Both all the time I was at the Philadelphia College and at Kentucky, I chaired the curriculum committees. And I wrote the PharmD program at PCP. I wrote the PharmD program at Kentucky. And and clinical pharmacy was on the horizon. Kentucky was looked at for deans at other schools at the time, and a number of our faculty went on to become deans. And Texas opportunity, I must admit, came along too early in my career. I didn't finish doing some things I wanted to do, but that timing wasn't mine, it was theirs. And I looked at Texas, and it was much like Kentucky. The school was very mediocre. The university was spectacular. I looked at that and I thought, step one is just upgrade the school to the level of the university. That ought to be easy. And they offered opportunities. They had a system that had 5 medical schools, and we integrated our pharmacy program into 3 of them. So all the things that I wanted to accomplish for the profession, I didn't accomplish everything I wanted to do personally as a laboratory scientist, but by that time I had gotten to the point where I got a great satisfaction out of other people's success, and that's very important when you're a dean. And so Texas came along and just had the right feel. And my faculty always told me that I didn't make logical decisions, I made decisions based on feel. And it felt right, and I went to Texas.
All right, so there is, you certainly are unique because you're the only pharmaceutical scientist that's been president of either the Academy or the American Association of Pharmaceutical Scientists. That was also president of the American Pharmaceutical Association. And so that creates an unusual dynamic. And I think it would be worthwhile for our audience to hear that perspective and your view of that interaction.
In part, it was the times, Les. Back in the 60s, there was a tremendous, the Russian embarrassment of America with its Sputnik put science and education on the map, and we had great public support. And there were many pharmacists like you and me who had professional pharmacy degrees and PhDs, and were both pharmacists. And so back in 1970s, being a pharmacist and a pharmaceutical science was a marriage that was pretty normal. Along came the issue of generics, and that kind of pulled me out of the crowd because I was working in the area of drug absorption. The generic issue was a drug absorption question, and it raised me to certain visibilities. The government wanted to implement a generic policy that affected pharmacy in many ways, and I got involved as a member of an Office of Technology Assessment study that one of the highlights of my career, really. And your colleague, Sid Riegelman, we spent many a day together on that committee. And that kind of brought me a focus among practicing pharmacists as a pharmaceutical scientist involved at those national issues. And then it went on that after the OTA report came out and said that we had to do certain things to really make generics legitimate, I chaired the federal government's committee that paved the way for bringing generics into federal programs like Medicare and Medicaid. And that too affected pharmacists directly. It affected their reimbursement, affected a whole lot of things. Their professional activities it affected. And so I was in an issue that crossed the boundary of both science and profession, and gave me a lot of visibility. And APHA was extremely helpful. I don't know if we have time, but I would have never been on that committee because the president's office tried to find out whether I was a Democratic Republican, and I didn't think that was important. And so I wouldn't. And finally, the local senator called, the university president called me. He said, president's trying to find out of whether you're a Democrat or Republican because he wants you on this committee. FDA actually wanted me on the committee. And I said, I know. And I said, you know, I think it's an irrelevant question. He says, well, I told him you were a Republican. And I got appointed.
Yeah, but that committee was, the technology assessment and the work you did was really important and really laid the groundwork, and you had a great influence, and we are all appreciative of it. I'd like to switch a little bit, and you have been, at least in AAPS, I think the driving force for making sure AAPS was part of FIPP. Yes. Was the International Pharmaceutical Federation, and I think that would be also a useful history of what your goals were and how we met those goals. I think we did.
Well, in fact, I think AAPS is really a crown jewel within FIP, and FIP has benefited, and I'm glad AAPS has benefited. When I was president of APHA, APHA was not in FIP. And we had this concept that every pharmacist should belong to APHA if you're concerned about the profession. And my reaction was, well, if that's true at this level, it ought to be true at the international level too. And so when I approached Bill, he says, it's wrong. It's like the United Nations. We pay too much money for too little influence. And I said, well, that's the price we're going to have to pay. And so APHA joined FIP, and I was extremely pleased with the involvement of APHA after that in FIP. So when I became president of AAPS, I had the same interest. And fortunately, I consulted for a company, Herx Roussel, that gave me worldwide activities. They sent me to many countries when we had issues that to look at, and I consulted for them. So I had a kind of international interest scientifically, and as you know, the European Pharmaceutical Science Group was extremely influential. I was active in USP, which also had an international swing to it. So I thought it important. I worried about it. I worried more about AAPS going there than APHA. I thought that the international community and a lot of the things that you did in developing international congresses, I thought, you know, that kind of thing, international is important. And FIP is the only game in town. So moving AAPS into FIP, I was very happy that the board went along with it, and we did it. I went to an FIP meeting this year, and it was great to see AAPS's involvement in it and the American involvement in it.
Yeah. So let's talk a little bit about, you've been very influential, not only in leading science, but also in mentoring your young faculty and giving them the opportunities to progress and to become successful. And of course, that leads to your school reaching the goals that you wanted to. But I think it would be worthwhile if you give us your philosophy of what a dean should be doing, not just the school in general, but the pharmaceutical sciences. Yeah.
Well, there's one thing I believe very strongly in. If you recruit extremely well, everything else is easy. If you recruit badly, everything else is hard. And we did, when we turned the corner and said, we are not satisfied and we must move forward. And back in the middle and late 70s and early 80s, again I go back to that Sputnik effect. We had a cadre of pharmaceutical scientists being trained and educated that were spectacular. They were spectacular. And all you had to do at that time was look among them and just let the best one rise out of the group. And so we spent a lot of time in recruitment, and I will always be indebted to the faculty we recruited between 73 and 85, because we were mediocre. I mean, we were not a first-class program, and they did it. I mean, they took a mediocre program, and in 12 years we were first class. And I'm proud that a little known fact that I'm very proud of is 14 of those people went on to be deans at other colleges of pharmacy. And again, I think what I said about Kentucky and what they did, what we did innovatively, and they continue to do innovatively, and what we did innovatively at Texas put a lot of attention to that young faculty as they developed. And last night I was to Jim McGinnity's retirement. Jim was one of those people back in 1979 that I recruited, and you know, he thanked me. I said, "No, don't thank me. I thank you."
Let's talk a little bit about, you know, state politics. University of Texas at Austin was the pharmacy school, and you raised it to a level that certainly it deserved to be. And it sounded like you had excellent support from your administration to do that. And then what's happening today? How do you view what's happening today with the plethora of pharmacy schools and the status of pharmaceutical sciences in some of these schools?
I'm worried about it. Two things that worry me. A lot of things worry me. Not many things worry me, to tell you the truth, at my retirement. But we had great public support. Back in the 70s and 80s, we couldn't have become a clinically oriented pharmacy profession without federal capitation grants. That was the fuel that moved us on as a profession. And we couldn't have become the scientists that we became without NIH and NSF funds. And we had great public support. When I applied for an NIH grant back in the 60s, I think something like 70% were approved. I mean, it was an embarrassment not to get one. These days, what's the number, 15% or something like that? Now, yeah. And we had great public support, and we had great opportunity. When I went to Texas, the tuition was $50 a semester, $150 a year for 3 semesters. Now it's something like $18,000. The public support, state legislatures, the federal government, its difficulties right now at NIH we didn't have those things. And we had an engine that we could run. And I look now and I think at where is the public support for what needs to be done? I mean, I think the United States has very competitively, our best are very competitive internationally. But our average, I'm not sure we're as competitive average-wise as we used to be. And I think that's the problems of lack of the Sputnik commitment. We must get better in science and math. We must get better in engineering and sciences. That doesn't prevail now. That doesn't prevail now. And that worries me a great deal. In terms of the expanding pharmacy schools, I never wanted to see an oversupply in the profession. I mean, that is deadly for professional services because people, I mean, we have become an employee profession and we're in business-oriented activities, and oversupply is deadly. And what worries me more is that we haven't seen the development of new University of California, San Francisco's. Those are not the programs that are being developed. When pharmacy transitioned into the PharmD education in the late 90s, I expected 1/3 of the existing schools of pharmacy to close. I didn't think they could cut it at a PharmD level education. And I expected pharmacy to move more towards medical center based education. And what's happened is that 1/3 I thought that was going to close has expanded to become the predominant factor in the profession, and that worries me because they are diluting out those very comprehensive schools like Carolina and North Carolina and Purdue and Michigan and University of California, University of Texas, University of Arizona. We're being diluted out by a type of school that has a different agenda. And it worries me as that tipping point changes what's in our future. It's not the future I had thought was going to happen.
So let me close by asking you to. You've had this wonderful career and so much influence, and many of us are very thankful to you for the contributions you made. When you go back and think about your career, what's the highlight that you view of it?
I do reflect positively on the Doluisio technique, and it's nice. When I was at the FIPP meeting a couple of years ago, that when I got introduced to a young scientist, they looked at me and they said, "You're alive?" And it's a technique that has survived, and I am proud of that technique. But I'm also proud to be one of those transitional pharmaceutical scientists, like yourself, who broke down barriers so that the clinical pharmacists could move forward. I don't think people today could remember back in 1960, we basically had a pharmacy curriculum that was close to being a baccalaureate in chemistry. And we had huge barriers, time constraints to the introduction of clinical pharmacy concepts. And there are certain quality pharmaceutical scientists, Jerry Goyen, Sid Riegelman, yourself, Joanne Toski, Larry Weaver, that stepped forward and said, no, we have to do this. We have to do this at cost. When we have a vacant position, we can't get another medicinal chemist. We really have to invest in clinical pharmacy. They were tough things to do. And in reflection, to be far part of that transition that gave enhancement and opportunity for pharmacy to become a more patient-oriented profession, I'm proud of that.